to be all about the structure and function of teeth. So adults usually have 32 permanent teeth, but some people have more and some have less. The complete set of adult teeth is called the permanent dentition, distributed between an upper arch and a lower arch. The anterior teeth are the front 6 teeth in both arches. The posterior teeth are all the teeth behind those anterior teeth, again in both arches. Incisors are the front 4 teeth and therefore incising or cutting food. The upper incisors are arguably the most important teeth for smile aesthetics, and they also serve a function in phonetics, producing F and V sounds when they touch the lower lip. Canines are getting closer to the corners of the mouth, and sometimes they're referred to as eye teeth, because if you drew a line straight down from the eyes, they would be pretty close to that line. They're longer and pointed for tearing food. The molars are for chewing, milling, and grinding food, and the premolars also contribute to chewing as well, but to a lesser extent because they're smaller, but they can definitely hold food as it's being chewed. Topics like tooth numbering and eruption dates are things covered in my basic dentistry video, so I'm not going to go over them here, but I do want to go over conventions for tooth naming really quick. When we talk about a specific tooth in the series, we're going to start with which arch it belongs to, maxillary upper or mandibular lower. Then we'll say if it's on the right or left side, and finally what kind of tooth it is. So for example, we would say for tooth number 8, that's the maxillary right central incisor. As part of this series, I'll go through each kind of tooth with you and look at the key landmarks and high-yield features of each one from its different views or aspects. We'll take a look at the facial view, or the facial aspect, also called the labial aspect for anterior teeth, or the buccal aspect for posterior teeth. We'll also look at the lingual aspect, which is also called palatal for maxillary teeth, since that surface is adjacent to the hard palate. We'll look at the mesial and distal aspects. We'll look at the biting surface, referred to as the incisal surface for anterior teeth or occlusal surface for posterior teeth. And lastly, some teeth I'll show you a cross section of the crown or root, and I'll refer to those views as internal because they're inside the tooth. All right, next, let's review some common terms that we'll refer to throughout this series. So a cusp is a pointed or rounded elevation or mound on the crown of a tooth. A tubercle is a small elevation on a tooth due to extra formation of enamel, so it's a deviation from normal. A lobe refers to a center of calcification from which a tooth develops, basically the separate divisions that come together to form a tooth. Often in molars, the lobes will become individual cusps. Most teeth develop from 4 lobes, but we'll go over this more in detail with each specific tooth. Mamelons refer to small bumps that appear on the incisal edges of teeth when they first erupt, and they usually wear away over time due to normal contact with opposing teeth. If they remain beyond the age of 10 on those incisors, then that might be a sign of an anterior open bite, where the front teeth just aren't touching. Imbrication lines are tiny little ridges or wrinkles that run horizontally or mesiodistally on the cervical third, that means towards the gums, of the labial surface of anterior teeth. The reason why they appear is due to the incremental enamel deposition as the crown is forming. Perikymata refer to tiny grooves in between those imbrication lines. And I'll show you examples of what this looks like in the next video when we talk about the maxillary central incisor. The height of contour is the widest part of a tooth, essentially the part of a certain tooth surface that sticks out the most on the facial aspect or the lingual aspect, etc. And I'll show you examples of that as well in future videos. The proximal contact is the area of a tooth in contact with an adjacent tooth in the same arch. And the last term on this slide is embrasure. So whereas a diastema is a space or a gap between two teeth, an embrasure is the space around teeth. So these V-shaped valleys that you see between teeth are called embrasures. And they allow for the passage of food around teeth so that food isn't as likely to be stuck in between them. All right, so some more terms. A groove is a linear depression in a tooth, and they come in different shapes and sizes. Developmental grooves are the biggest ones, and they're formed by the uniting of lobes during development of the crown of a tooth. So for example, on tooth number 12 here, there's a central groove that you can see that's between the three facial lobes and the lingual lobe. There are also smaller, shallow grooves called supplemental grooves that give the occlusal surface a more wrinkly appearance. A fossa is a shallow, rounded, or angular depression, usually at the coalescence of multiple grooves. So, for example, this premolar has two triangularly shaped fossa here. A fissure is a deeper than normal groove where there was an imperfect union between those developmental lobes. I would definitely call this a fissure right here on tooth number 15, a deeper than normal groove. A pit is a place where grooves or fissures come together to create a small pinpoint depression. This is where decay is most often to begin, and that's why sealants are often placed in the pits and fissures, to prevent decay in those areas that are most susceptible to decay and hardest for the patient to clean. Tooth number 13 here, for example, has a mesial and a distal pit. A ridge is basically the opposite of a groove. It's a linear elevation of enamel on a tooth crown, and they also come in different shapes and sizes. Marginal ridges are elevated areas that form the mesial and distal borders of teeth. Triangular ridges descend from a cusp tip and widen as they run down toward the middle of an occlusal surface. And last term on this slide is cingulum, which is a convex protuberance on the lingual surface of anterior teeth, right next to the gingiva. And we'll take a closer look at this U-shaped ridge when, again, we talk about the maxillary central incisor in the next video of this